Good morning and welcome to this Cardiff University webinar. This is the latest in our series of webinars under the title of Informing Policy, where the university provides a space for Cardiff University academics to speak directly to policymakers on a variety of topics where their research can help inform policy development. As well as hearing insights from researchers and reflections from practitioners at the front line, our attendees can also contribute to discussion through a Q&A under Chatham House rules. Today's webinar looks at the implementation and evaluation of the whole school approach to emotional and mental well-being. In our session, Dr. Rachel Brown and Professor Simon Murphy from Decipher discussed the implementation and evaluation of the Welsh Government's guidance on the whole school approach to emotional well-being. The programme aims to support education settings towards implementing data-driven whole system approaches with the aim to involve all key stakeholders in creating settings conducive to promoting better mental health and well-being through all day-to-day actions at schools. We'll be hearing insights today from Dr. Rachel Brown and Simon Murphy from Decipher, who are looking at the implementation and evaluation of the whole school approach to emotional and mental well-being in schools. The programme aims to support the education settings towards implementing data-driven whole system approaches with the aim to involve all stakeholders in creating settings conducive to promoting better mental health and well-being through the all day-to-day actions at schools. This policy is supported by data provided through the School Health Research Network, a biannual survey of pupil health and mental well-being run by Decipher. We'll hear from Rachel and Simon, and we'll hear contributions from Public Health Wales. Rachel, will you be starting?
No, Simon's first up.
Lovely. Simon, if you want to let me know when you want me to move the presentation on, I will just share screen.
Thank you, Jan. Morning all, and I'm going to start off the presentation and give a little bit of background to the particular policy we'll be talking about today and discuss some of the sort of capacity and infrastructure we've built within Decipher and how we're putting this to work around this particular policy. So Rachel's going to be talking about the actual whole school approach strategy and what we're doing around that. So a little bit of background: we're working within Decipher, but the actual work around the policy is a partnership that we're working with the Wolfson Centre for Young People's Mental Health, which both Rachel and myself are part of that centre. I suppose there are a number of challenges really in terms of evaluating policies at national level. And over the years within Decipher, we've built both capacity and networks to facilitate that. So you can think about that sort of focusing on a number of different areas. So we've been sort of central in terms of developing guidance for both policymakers, researchers and funders in terms of how about going about sort of evaluating policies. We've developed guidance with the Medical Research Council for evaluating complex interventions. And we've been mentioned in the Magenta book for policy evaluation by the Treasury as developing good practice in the area. And we've also seen some of our guidance around sort of co-production mentioned in the SAGE groups for COVID. We've also developed a number of short courses in this sort of area, and those sort of short courses are focused not just on academics, but policymakers and practitioners at the same time. So they're in the same room discussing how we go about doing sort of policy evaluations and developing shared skills in the area. What has this work been put to? Well, again, over the years, we've facilitated a number of policy trials. One of the first we did was primary school free breakfast initiative within primary schools across Wales. And we did a big randomised control trial around that and identified the effectiveness of the scheme, particularly in terms of addressing inequalities. Other sort of key policies we've been involved in is a national exercise referral scheme, and again we were able to sort of roll that out and work with government to evaluate it within a randomised control trial. Another example is alcohol and social norms in universities, and again we did a sort of early stage sort of trial around that. And we're able to make recommendations to government for next stage. We've also worked to actually develop national policies from the ground up. And a good example of that is the Decipher Assist Smoking Peer Prevention Programme. So we developed that and then worked with Public Health Wales to roll that out, and it's been diffused across the UK, France and Colombia as other countries have taken it up. And again, another example of working with government is that we were able to provide some key data and understanding of the implementation of new tobacco control laws and the exposure in cars for children and young people. And again, that informed national policy. And again, some of that work has been cited in New Zealand in terms of the development of policies they've got in similar areas. Next slide, please, Jan. So we've not just developed that capacity and guidance, but we've developed up an infrastructure within Wales to facilitate these sorts of studies as well. And a prime example of that is an infrastructure that sits around the schools in Wales. We've really tried to think about replicating some of the clinical research network models and the learning that we've got from that, which facilitated research in that area. So we established it in 2013, and we've got every secondary school in Wales as part of this, and we're currently rolling out to primary schools. And what the network does is provide key data for national, regional, and local stakeholders to drive health action planning, so that the data is fed back into schools and into regional stakeholder sort of planning and national planning. And it also provides us an opportunity to co-produce research studies and to reduce the research burden on schools, and also develops capacity for evidence-informed practice. And the idea is really taken a hold, and we've helped set up sister networks in Scotland, Manchester, Southwest England, and we've done some pilots with the WHO in Europe, and we're currently discussing in Oxford region about developing a similar network for them. Next slide, please, Jan. So the SHRN infrastructure is driven by these biannual surveys. So we do them every other year, and it's a people survey, but also a sort of senior leadership environment survey. And we routinely get really high response rates to this. So the last survey we did, we had 98% of all the schools, secondary schools doing it. And we had responses to the senior leadership teams of 81%. And we also had 70% of all pupils in Wales, 11 to 16-year-olds, completing it, which translates to a sample of 120,000 pupils. Next slide, please, Jen. As I say, that data works in a number of different ways. So it goes back to schools, regional and local action planning, but it also goes to Welsh Government for population needs, trends and international comparisons. But it also goes to our Public Health Wales partners, so the Welsh Network Healthy Schools scheme there, in terms of trying to understand that implementation. And it provides infrastructure to support our new studies, as well as infrastructure to support the rollout of new policies. So those include, for example, natural experiments, but also implementation studies. And that's the point that I'm going to hand over to Rachel to say how we're using this infrastructure for this particular policy. So Rachel.
Thanks, Simon. Yeah, so next slide, please, Jan. Okay, thanks. Yeah, so I'm just going to tell you a bit more about how we're using the data infrastructure that Simon's described as part of the evaluation of the Welsh Government framework on a whole school approach to emotional and mental well-being. So I'll give you a bit of background about what we're actually doing and then some of the policy links that we have in this piece of work. Next slide, please. Okay, so just by way of background, the framework guidance was rolled out in March 2021. And that basically required that all schools start to work towards embedding a whole school approach for mental and emotional well-being, which essentially means that all stakeholders within the school are invested in an approach and that it permeates all day-to-day practices across the school. So it's an attempt to move away from more reactive, more bespoke responses and try to actually embed good practice across the whole school system, involving pupils, families, as well as all school staff and those around schools in supporting roles. Welsh Government provided funding for Public Health Wales to lead on the actual implementation, and they developed a self-assessment tool. So part of their work has been rolling out that self-assessment tool for schools, so that everybody is encouraged to complete a baseline assessment. And that includes current practice, staff training, and also looking for secondary schools, looking at their SHRN data to try to understand the profile of mental health and issues within their particular school setting, with the aim that responses can be tailored to need and very much specific to the school and the community. So we did some preliminary development work as part of this study. So we published a theory of change and evaluability assessment in January of last year. And within that work, what we looked at was how a whole school approach may be evaluated. So some of the complexities and challenges in evaluating something which is actually a very complex intervention. And that report really did highlight some of the sort of issues that we needed to consider in the design of the evaluation that we currently have. So I'll just describe some of the evaluation plan that we developed as a result of that first work. So next slide, please. Okay, so some of the particular challenges in terms of evaluating this policy are that obviously it's already been rolled out to all schools. So we don't have a kind of pre and post assessment, and we don't have a comparison group within Wales. So all schools are now required to act on this policy. So it means we have to think in a slightly different way about how we approach this evaluation. Also, we wanted to look at change in as broad a sense as possible within the system to try to capture as many policy effects as we could. So to do that, we came up with a theory-based evaluation approach where we aim to collect a broad range of evidence from a number of sources. And the aim is to reach a conclusion on the overall contribution of the framework. And that's in two key areas. So firstly, in the trajectory of young people's mental health. So from the shared data, we have historical records. We can look at the trajectory over time and look at how mental and emotional health and well-being is anyway and has been among that population. And obviously, we're mindful that we do need to situate that within the context of COVID recovery and the fact that the trajectory is likely to have been impacted in some different ways anyway. So we're taking that into account in the way that we're doing that. And also we're looking to identify changes to the system of both within and around schools. So that's including how schools perhaps change their way of delivering mental health and emotional wellbeing support, but also how those supporting and surrounding services that work with schools may change their practice in response to the framework as well. Okay, next slide, please. So we have three work packages. This evaluation is going to continue through to 2025. So we've got plenty of time to capture the full phases of implementation and then look at how this perhaps becomes embedded within the delivery system as well. So within work package 1, what we're looking to do is describe existing practice in schools as it maybe looked prior to the framework. And then we're going to look again in spring to autumn next year and look at anything that might have changed in that kind of school's practice. So to do that, we're using a lot of routinely available data. That includes ESTIM reports on mental and emotional wellbeing dimensions, excuse me. We're also looking at the National Quality Award reports as well to identify what schools were doing before. And we're looking at our school environment survey, school environment questionnaire as well, which Simon mentioned, which is completed by school leaders. So that'll give us a kind of background of what schools were actually doing in this space prior to the framework. And that will then allow us to more effectively detect change as we go forward. We're also working with Public Health Wales to access their data from their self-assessment tool and the evaluations that they're doing as well. We're then conducting a series of interviews with stakeholders who have a role in supporting mental and emotional wellbeing within schools, including the delivery of the whole school approach. So that includes the implementation leads in public health teams, healthy schools coordinators, wellbeing staff in local authorities, and anyone else who might be involved in a regional level. So things like CAMS in-reach teams as well have become a part of this, and education consortia. Okay, next slide, please. We're then completing a series of case studies with schools, so working with both primary and secondary schools across regions of Wales, including 2 Welsh medium schools. So we're looking at school activity at 2 time points. So we've just completed the first round of data collection with schools, and we're going to go back in about a year's time to assess anything that's changed. And within those schools, we're completing interviews with staff and pupils. So we're doing 2 pupil groups and a staff group of those who are directly involved in health and wellbeing. We're analysing school policies to look at any sign of embedded change, any response to the whole school approach, and we're going to do that again over time. And we're doing walkarounds to look at on-site culture, including sort of any visual presence of their ethos, any sort of visual indicators of how they approach mental health and emotional well-being now. So that includes things like signposting to support services, supportive messages, use of language, use of safe spaces, anything about the physical environment that tells us what that school currently does. And then we're also hoping to access nationally available data. So we're working with partners from Welsh Government at the moment to look at whether we can access trajectories of attendance, behaviour, and then onward referrals for support. Okay, next slide, please. And then the third is using that data infrastructure that Simon's been talking about. So we're going to use the Shern and primary Shern survey data, and we're going to do a time series analysis of pupil mental health and well-being. So that's that trajectory analysis I mentioned at the beginning. And then we're going to do a similar time series analysis for the school environment questionnaire data to look at senior leadership responses around issues like staffing allocation for health and well-being work, how schools select their priority actions, and we'll look at whether the whole school approach framework changes that emphasis at all and whether there's any increased focus on mental health and well-being. Okay, next slide, please. So just to highlight some areas where we're working very closely with policy colleagues in this evaluation. There's so many sort of people working in this space at the moment. It's been very important for us to try and coordinate these relationships and make sure that we are all communicating effectively so we know who's doing what in this area. So we have a co-location agreement with Public Health Wales, where a member of their implementation team is located in our centre around once a month. And we have regular meetings to share, to a point, but to share information about what we're each doing and how we're progressing and any kind of key changes and policy developments that we should each know about. I attend the Public Health Wales implementation steering groups as well, so I can update that group on the progress of the evaluation, and they in turn can update me on their work. We have a data sharing agreement, so they provided us with the National Quality Award reports for analysis, so that's been quite key for Work Package 1. We have a member of the Welsh Government policy team in this area who sits on our study steering committee as a non-independent member, who can be then kept updated about what we're doing and also feed in any key developments for us as well. We've made regular presentations as well to key partners, so the Welsh Government Task and Finish group, as well as various Public Health Wales forums. And we're also liaising with both parties on surveys that are sent to schools, so we can try to manage the resourcing, the required in schools, the kind of workload for them, and make sure that we've all got good quality data that can contribute to this. Okay, that's it. Thank you very much. So I'm happy to discuss further.
Lovely. I will now finish the recording.